Hello my dear students. So today we'll be seeing a very important topic which is often asked in fmge questions. So I'll just color it red. Okay. So this question is commonly asked in surgery. A picture of an x-ray with a background history of trauma. That could be a blunt trauma, that could be a penetrating trauma. It does not matter. It could be a gunshot wound. So you would be given an x-ray like this, basically an x-ray like this, which looks, the lung fields looks pretty normal, but you could see some changes over these two portions. So this visible area is nothing but air or gas. So there are two places you are able to see gas below the diaphragmatic area in this x-ray. So you need to know this is air under diaphragm, this portion is air under diaphragm, this is normal stomach fundus air. Okay, and the diaphragm is very intact, but here there is clearly air under diaphragm is seen. So you should never miss this MCQ. So what kind of question you will get? You will get a trauma history. You will get a patient having probably chest pain, pleuritic chest pain, or patient on dyspnea or abdominal pain, but pronounced hypotension, low blood pressure. This patient is having air under diaphragm, gas under diaphragm, which is suggestive of most probably perforation. So intestinal perforation is the answer they are expecting from you. It's intestinal perforation secondary to trauma. Hypotension means patient is having perforation leading to leakage of the bowel contents, enteric contents, that is causing shock, septic shock. So this is how the question would follow. So resuscitation is very important step in this, but early resuscitation and early shift to operation theatre for exploratory laparotomy would be a better option, quick option that you should do, because this is definitely a killer condition for the patient. Next is, this is a random pic taken from the internet just for the sake of comparing the different gases under the diaphragm or the intestinal or fundal gases. So the first pic we are seeing here, we have already seen, this is clearly, this is diaphragm, so this is air under diaphragm, this is very clear. And here again this is diaphragm, you can see clearly this is air under diaphragm, gas under diaphragm. This is definitely a stomach gas, fundus of the stomach gas, but in between those two you could see this layer, which is gas in large intestine. So these three gases you should be very clear with when you're dealing with your MCQ. So here is air under diaphragm, gas under diaphragm, again gas under diaphragm, but in between the gas under diaphragm and the gas in the fundus there is gas in large intestine. So these 3 points you should know when sorting out the MCQs. I hope this discussion helps. Thank you.